Good day to everybody. On behalf of Endocrine Society of India, it's our pleasure here to have with us Professor Subhankar Chowdhury, Professor and Head, Department of Endocrinology, IPGMER, Kolkata. He's also the editor-in-chief for the Indian Journal of Endocrinology and Metabolism this past year. He's been the president of Endocrine Society of India 2012 to 2013. He's a member of the subject expert committee at CDSCO Government of India. He's a founder patron of South Asian Federation of Endocrine Societies. He's also the president of Endocrine Society of Bengal. And he's here with us to share his thoughts about the evolution of Endocrine Society of India and his reflections about his presidential tenure. Over to you, sir.
Hi, Chitra. It's a pleasure to interact on the ESI platform always. Well, during my tenure, that was several years back now, but I would say one of the things that started at that time in an active way is to reach out to endocrine societies even outside of India. And in fact, the SAFES, South Asian Federation of Endocrine Societies, was born during my tenure as president. And I remember we went down to Colombo for a wonderful meeting hosted by Sri Lanka. However, I must also admit in the same breath that it was not really my doing, I must accept. It was more Sanjay Kalra, it was more Sarita Bajaj, but I was there, of course. And so we can take some pride in that. And at the same time, in the same year, I remember that I, as president of our endocrine society, attended a meeting, a couple of meetings actually, and a physical meeting in USA, because next year in Chicago, the Endocrine Society was holding a joint conference with International Congress of Endocrinology. And so I was there and helped in a small way to select speakers, to select topics for at least one particular part. So it always feels good to be on the world stage to represent your country. So I think that's something that started and that's now grown bigger. And I'm very proud of that.
Yeah, thank you for that significant contribution. So I think Endocrine Society of India is definitely standing on the shoulders of giants such as you. But how do you look the future of the Endocrine Society of India will shape up, and what thoughts might you have to share with the many young endocrinologists who are passing out and joining the strength of Endocrine Society of India?
I think we are only going to sort of increase in strength. There is no looking back. And I'm extremely happy and proud that we have a very strong young group of endocrinologists who have come up and doing a great job. Having said that, if I need to advise them, mm, I would suggest a few things. One of which is in this era of technology and information, uh, sort of IT, uh, I would like to remind ourselves, including our young endocrinologists, that statistics is not the answer at every stage. There is a definite scope and role for human judgment. We should not forget about that. Secondly, we need to be careful about our relationship with the industry. We have to depend upon them for a whole lot of things, but we need to be careful that we are not misused by the industry. And third and final, I would say that, let's say when we are asked, why should we use SGLT2 inhibitor ahead of other drugs? Quite often the answer I hear is because ADA 2021 has said that SGLT2 inhibitor should be up in the list. So that clearly should is not the right answer. I mean, even ADA 2021, even AACE would also sometimes, I feel strongly, is what they say is determined by what the industry says. So we need to also have our own understanding as to what or why we're doing certain things. So these are a few small tips, but I'm really proud of the young generation. And Chitra, you belong not quite in the young generation, but maybe somewhere in between. And I really am proud of you and all the others in your group.
Thank you for all the kind words, sir. We will definitely keep your words of wisdom in mind. I think the interaction with industry is a very precarious walk. And thank you so much for being the professor and teacher that you are. I have learned all of endocrinology and many more life lessons as well from you. And it's an honor to have you here today with us. And thank you for sharing your thoughts. Thank you, sir.
Thank you. Thank you. Have a very good year ahead.
You too, sir.